We've all been social distancing for some amount of time, at least. Well, I shouldn't say all. There's still some parts of this country and others that aren't practicing yet. But talk a little bit about social distancing and whether or not it's working.
Yeah, I mean, I think, as we brainstormed last week about what we wanted to focus on for this week's update, it was my sense that we're all getting a little tired now. We've had a little too much family time. We're getting sick of the people we love, even though we love them a lot. And so, I really wanted us to have an epidemiology kind of heavy update, if you will. And that was to reinforce the message that social distancing is working. To Janet's point a moment ago, she being in King County, Washington, which was the initial epicenter of the pandemic here in the US, and me being in the San Francisco Bay Area, Upal being in New York City, we've been on, the front sides of this, the front edge of it, and really seeing the impact on the West Coast of early stringent policies that were put in place. And because of that, we're beginning to see hints that we're flattening the curve. That's the other, key language that we're all, incorporating into our everyday language now. We know that it's working, and it's critically imperative that we don't let up just because it's starting to get uncomfortable and starting to get tiresome and people are bored. This is something we have to maintain. And so much so that even in California, where I am, we extended that shelter in place policy through early May. We made it more restrictive because we see that it's working, and we know that doing more is going to save more lives. So yes, social distancing is working. And, so that's encouraging because, as I said, this is a virus for which we don't have an existing treatment. We don't have an existing vaccine. None of us are immune. The only steps we can take to protect ourselves are these: social distancing, washing our hands. Upal's the public health expert among us. He can speak very eloquently on why all this is important, but we know it's working. So yes, we have to keep doing it.
In Seattle, we started social distancing before anybody else. And the reason we did is we have the great advantage of having the Fred Hutchinson Cancer Research Center here in Seattle. And they happened to have a flu study that was looking at the spread of flu in the population and happened to test some people for COVID as part of that, and discovered it was spreading in the community. And within days, our governor listened to Fred Hutch and they started shutting down. We had people who knew what to look for, and the scientists who could make a case, and politicians who listened to them. And that's one reason that our cases are not climbing as fast as anybody else.
Yeah, I think that's a really good point, Janet. And I think that the similar type situation has happened here in California. And Amy kind of touched on it. Some of the restrictions have gotten even sort of tighter in that if you can't ride your bike outside of a 5-mile radius of your home, so they're really kind of making sure that people are staying where they live. So really, really great point.